Hello, and welcome to another episode of the Chesapeake Thrives Show. Today, I have a special guest with me from Southeastern Virginia Health Systems, Shelby, to talk about their services. Hello, Shelby. How are you doing today?
I'm good. How are you?
I'm doing pretty good.
Good.
So, can you explain to us exactly what is Southeastern Virginia Health Systems?
Yes. Southeastern Virginia Health System, we are a federally qualified health center, known to some as FQHC, meaning that we receive federal funds to provide quality health care to the underserved patients in the community.
Okay. So, what you're saying that for underserved patients that live in the community, do they all have to have any sort of insurance or anything to receive your services?
So Southeastern Virginia Health System, we provide quality health care to all patients, whether they're insured, uninsured, or underinsured. So I say underserved patients because we receive special funding to assure that all patients, whether you're insured or underinsured, we want to assure that everyone receives the quality health care that they need and deserve, regardless of your income status or your insurance.
So with that too, what you're saying that you serve everyone. So what are some of those different resources or services that you provide underneath your system?
Okay. So we're community health. We provide primary care services, medical, dental, behavioral health, and women's health care to adult and children. Also, we have support services, which health care for the homeless, Ryan White program for patients with AIDS and HIV. We partner with Every Woman's Life, which is EWL, to assure that females receive the mammograms that they need for free if they're uninsured. And we also have health education.
Okay. Okay, so you have a variety of different things that you actually support in those areas. So do you actually support for like pediatrics, or do you provide telehealth services too?
Yes, ma'am, we do. So for pediatrics, we do have pediatric offices. And one great thing that we're doing for our pediatrics are we're accepting sick children on a walk-in basis. So if you have a child and the child wake up in the morning and he or she is sick, then you can walk into our office without calling and scheduling an appointment. But also, we see well children too. So for the well child visits, you will have to schedule an appointment for that. But I just want to put emphasis on if you have a child who's sick, you do not have to wait for an appointment. Feel free to walk into one of our facilities.
And I think those walk-ins are very important because sometimes it's like in a rush for a parent, they just like, okay, I need to, seek some type of help for my child right here and now. I can't just wait another 2 or 3 days or a week later. So those walk-ins are very important for pediatrics.
And then another thing is, although a child is sick, it may not be an urgent situation or an emergent situation where you have to go to urgent care or emergency room. So coming to a primary care office and seeing a pediatrician is sometimes the best for the parents in some situations. And we're here for everyone.
That's good.
And also you mentioned telehealth. Yes, we do provide telehealth services. If you are a new patient, you will have to come into the office and have a face-to-face visit with our providers. And then once you've established that relationship with the provider, then as an established patient, you can receive telehealth services. And some patients, they don't feel comfortable coming to the office. They don't feel comfortable leaving home. So we have telehealth services where the providers can have a face-to-face conversation with you through your electronic device, laptop, telephone, it doesn't matter to us, but you can receive health care in the comfort of your own home.
That's wonderful. So it's like I said, it's a variety of different things that you all actually offer. And it's for the comfort of the patient. I think some people have fears sometimes of seeing a doctor, whether it is an adult or it is a child. So the fact that you actually offer that service is telehealth, that's a wonderful thing for them.
Yes.
So another thing I want to ask you too is that I believe you're having an event that's coming up as well. Would you like to speak on that?
Yes. So we're having a women's conference, and the women's conference is titled EmpowerHER. and the theme is my season. So this event will happen on May 9th. It's Mother's Day weekend. It's the Saturday before Mother's Day, and it will be held in Newport News at the Holiday Inn in Newport News on Omni Drive. And we're looking for all ladies to come out. This is going to be a wonderful event. We have amazing speakers. We have amazing vendors. We have so much that we're planning for the ladies. And it's just basically an event to help to uplift ladies, just to let them know that you are enough. We're going to have breakout rooms as well. And the breakout rooms we're going to talk about financial literacy, mental health, entrepreneurship. We're going to have a lot. We're going to talk about the whole woman, the woman as a whole. So we're just excited about this event. This is our first women's conference. And I know some people may say, why would a healthcare facility hold a women's conference? But we just hold everyone close to our heart. We are all about community, and we just felt that talking to the ladies and helping the ladies on Mother's Day weekend would be an awesome thing to do. And so that's the reason why we designed this event. So.
Yes, Empower the Women Conference.
Empowering the women.
That's
right.
wonderful. So how can people actually tune in to receive tickets or join in for that conference?
Okay, so it's very easy. Just visit our website, www.sevhs.org. And once you're on our website, the flyer will pop up. Click on the link and you're in the registration.
Okay. Well, one more thing for you too. So what are some of those locations for Southeastern Virginia Health Systems, like on the emphasis for like the city of Chesapeake? Where is one location that's in Chesapeake?
Yes, so we have an office in Chesapeake and is on Liberty Street in Chesapeake. We also have offices in Newport News, Hampton, Virginia Beach, Chesapeake, Franklin, and Suffolk. So we try to blanket the Southeastern Virginia. So regardless of where you work and play, as they say, there's a medical facility right around the corner from you.
Yes, there's a medical center right around the corner
Right
for you.
around the
So
corner.
always remember Chesapeake. We have a location here too in Liberty Street. So thank you, Shelby, for joining us today for this episode. It's been great to talk about your program.
Yes, and thank you so much for having us.
You're welcome. And thank you for tuning in for another episode of the Chesapeake Thrives Show. We will see you next time.